Chapter 11. Students who are deaf and hard of hearing. Students who are deaf need to be provided with a challenging academic curriculum. They may learn to communicate through any of several communication methods. Whatever the communication method, the richness and complexity of deaf culture provides a powerful context for learning and personal development for students with hearing loss and their families. This chapter contains many important key terms. The first one is deafness, which is usually defined as a hearing loss that precludes the learning of language through hearing. Hard of hearing is a term used to describe a hearing loss that, although it's serious, it's less severe than deafness and usually permits the understanding of spoken language with the use of hearing aids. Hearing impairment is an umbrella term that refers to all degrees of hearing loss, from slight to profound. And because many people who are deaf or hard of hearing object to the term impairment, the phrase hearing loss is used in this chapter. The deaf community is a term that refers to those adults who are bound together by their deafness, the use of American Sign Language, and their culture, values, and attitudes. Here are a few more definitions that are pertinent to this chapter and important to understand. Acquired hearing loss is a loss that occurs after the child's birth, and it can be due to many different things, such as a virus or an illness such as meningitis after birth. Prelingual deafness is a hearing loss that occurs before the child develops spoken language. Postlingual deafness is a hearing loss that occurs after the child has developed spoken language. And residual hearing is the remaining hearing of a person with hearing loss. So some people who have hearing loss may have some residual hearing, meaning that there's a little bit that they can still hear, as well as people who are deaf. The research shows that people who are deaf may have some residual hearing. This slide that depicts the structure of the ear will be helpful in you understanding the causes of hearing loss. So the human auditory system, first of all, is very complicated and extremely delicate. Hearing depends on the transmission of sound waves across numerous tiny structures throughout the auditory mechanism. So when there's damage or obstruction in the external or middle ear, it disrupts the efficient passage or conduction of sound through those chambers. And as a result, there is what is called conductive hearing loss. When there's damage to the cochlea or the auditory nerve in the inner ear, it is called a sensorineural hearing loss. Mixed hearing loss refers to those individuals who have both conductive and sensorineural loss. Now, hearing loss can be unilateral, which means loss in one ear, or bilateral, which means there's hearing loss in both ears. Hearing loss can also range in severity from slight to profound. So children with losses described as mild and moderate, those individuals are usually called hard of hearing. Children with severe and profound losses are considered deaf. But keep in mind, even most deaf children, they still have some residual hearing that can make a hearing aid helpful. There are two major kinds of hearing loss: conductive and sensorineural. This table depicts characteristics of these two major hearing losses. You can see duration, location of problem, treatment, impact on hearing and learning, and some services provided. Let's talk about causes. Now, we know that the most common cause of conductive hearing loss in children is middle ear infection. It is also known as otitis media. Middle ear infection can have serious effects on hearing and should be brought to the attention of the child's pediatrician, because many middle ear infections can be treated with antibiotics. In some chronic cases, they are often treated with the insertion of very small tubes in the ear. Causes of sensorineural hearing loss usually means that there is going to be a permanent condition that cannot be medically treated, and that makes special education services necessary. Now, the major causes, they change over time, and it depends on the occurrence of the epidemics, the development of new drugs and medical treatments, and also on public health conditions. So for sensorineural, we know that heredity and genetic factors play a large role. We also know that meningitis, which is a bacterial infection or a viral infection, that causes inflammation of the coverings of the brain and spinal cord and can cause deafness as well. Prematurity and traumatic medical events that are associated with premature birth and low birth weight, and sometimes other illnesses, that's associated with hearing loss. In an earlier chapter, we talked about CMV and the RH factor, so the mother-child blood incompatibility. Those can also cause some hearing loss. Keep in mind that students with hearing loss and additional disabilities, which is about 40% of children whose primary disability is deafness, those children also have another disability, or what we call a secondary disability. Now let's look at some characteristics of students with hearing loss. We know that hearing loss has its most pervasive effect on the development of spoken language. It does not appear to affect cognitive or intellectual development, but it can have significant impact on school achievement. So let's look at language development. We know that for a child, the primary disability of hearing impairment is not the deprivation of sound, but the deprivation of language. So many children with hearing loss start school with a significant language delay. Now, research on the language development of children who are deaf and hard of hearing has found that their acquisition of English occurs in the same order as that of hearing children. So the same way it occurs in children that can hear, but at a very slower rate. So that's language. In terms of cognitive and intellectual development, we know that people who are deaf and hard of hearing have normal or typical cognitive and intellectual disabilities. In terms of school achievement, the research shows that despite the typical cognitive and intellectual abilities of most children with hearing loss, their average school achievement is significantly below that of their peers. In terms of social and emotional development, we know that there is a lot of frustration that can rise from poor communication. And this frustration can spill over into the child's behavior. It also can spill over into the child's relationships and in their motivation. Now let's look at some common approaches for developing communication skills. The ultimate goal for most teachers of students who are deaf or hard of hearing is for students to become fluent, competent users of English. So although there is also an increasing emphasis placed on the acquisition of fluency in ASL, so American Sign Language, most students with hearing loss and most teachers' training focuses on the development of skills related to language development. So some programs may emphasize the use of speech and others emphasize the use of sign language. Let's look at the first one, the oral approach. This approach is built on the belief that children with hearing loss can learn to talk and that speech should be their primary means of expression. Now, the oral approach is tied to the development of listening skills. So a little bit of what is called auditory training. And the auditory training in itself, it does not allow the child to hear new sounds or words. What it does is it helps the child make sense of what is heard, and it helps them use their residual hearing as well as possible. The manual approach is a little bit different. There are two components to it. The first one is finger spelling. In this method, words are spelled out by letters using the manual alphabet. Signs are symbolic representations of those words that are made with the hands. So American Sign Language, or ASL, that is considered a separate language from English. And for many children who are deaf, that is their native language. So if you know ASL, you're considered to be bilingual or trilingual because ASL is considered a separate language. It uses the same vocabulary as English, but in a different grammatical structure. Total communication is another approach, and total communication was designed to use any and all methods of communication with students who are deaf. Most practitioners equate total communication with the simultaneous method of using speech. However, there are communication controversies that have dominated the field of deafness, and different proponents have different approaches. Everyone's committed to their philosophy. Today's research just tells us that what is more important than the actual communication approach is the commitment and support of parents. This slide depicts one component of the manual approach. In fingerspelling words, what the person is doing is spelling out the letters of the words using the manual alphabet. So this is your A through Z manual alphabet. There are so many specific instructional issues with students with hearing loss that it's a wonder as many of them are integrated into general education as they are. Let's look at some technology that can help. So hearing aids is one, and we know improvements in hearing aids have made them smaller and more efficient. They're tinier, lightweight. Still, these are seldom recommended for children. Digitally programmed hearing aids can improve the wearer's ability to hear in the presence of background noise, but again, it just depends on the child. Researchers around the country have been surgically inserting what are called cochlear implants in a growing number of children who are profoundly deaf and who have sensory neural hearing loss. Assistive listening devices in classrooms, in theaters, and elsewhere make the sounds of the environment louder, and this is a big help for children with sensory neural hearing loss.